This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
And welcome to two very special people who are going to help our viewers understand that the Virginia Association of Free Clinics is the Virginia Association of Free and Charitable Clinics. The name has changed in the last year or so. Linda Wilkinson, who's the CEO, and Colin Drozdowski. Colin Drozdowski. Okay, I just about got it, Colin. We'll go with Colin and Linda from here on out. And we're so delighted to have you here as chair of the board of the clinics. Linda's the CEO. To help our viewers better understand what you do and where you're doing it and where the gaps are and all that information. We have several things that we'll be putting up on the screen as you make reference to them. So Linda, start us off and tell us a little bit about how do we get free clinics in Virginia?
So the association started in 1993, first of all, and it's an association with members, so we represent charitable and free clinics, and I'll make the distinguishing factor between those two in a moment. But we represent our members here at the General Assembly. We advocate on their behalf on issues ranging from tax credits to general funds that are available for their free clinics to COPN or Certificate of Public Need issues that are significant for our members, as well as licensure issues for our providers, whether they be volunteers or paid physicians. The free and charitable clinics really rely on volunteers. Last year, about 5,000 volunteer physicians and nurses served in our 60-member clinics, from ENTs to dermatologists to primary care physicians, treating the most vulnerable and some of the sickest adult patients in the Commonwealth.
So 5,000, is that all the healthcare providers you need, or should, if some of them are watching, do you need some others?
You could put a zero next to that number, it would be better.
Yeah.
We certainly do have demand exceeding supply, depending on some of the clinics. They're beyond capacity today. You know, we're very appreciative, very thankful for the 5,000 volunteers that we have, but our needs continue to grow year over year.
So you say there's a distinction between the free and charitable?
So free for some of our members, a free clinic is truly exactly that. It's free. There's no charge or fee whatsoever to our patients. And for the charitable clinics, they charge an administrative fee, maybe $10 or even $2, depending on the type of service provided. So you could go to one of our charitable clinics and receive a prescription for maybe $2 and get your teeth cleaned for $10. None of our patients are turned away or denied service based on their inability to pay that administrative fee. So that's the difference. Free is truly free. Charitable means a voluntary administrative fee.
Okay, I think one of the graphics that we might as well go ahead and get up on the screen for our viewers right away shows the map of the Commonwealth, and it indicates on there where the clinics are. So let's see that that's up right now, and then what would you tell viewers that they're seeing? Are they pretty equally distributed around Virginia?
I'll start, and then you can
Go ahead.
jump in. Certainly, we have 60 member clinics across the Commonwealth. Our footprint is broad, in the sense that we do have coverage throughout most of the geographic regions of the state. The demand varies from market to market or area to area. So, in some cases, we may have a clinic, but as I mentioned earlier, the demand for services outpaces the ability of that clinic to serve the needs. So we do have broad geographic coverage, but again, the demand is greater than the supply.
And you wouldn't be surprised probably that our clinics tend to be in the high populated areas, whether it's in Hampton Roads, Northern Virginia, or here in the Richmond area. But unfortunately, we don't have a lot of clinics or any clinics in areas such as Mecklenburg and Lunenburg. Most of our clinics bubble up through a grassroots effort, through a local church or civic groups, or even some local businesses who get together and want to form a clinic to serve uninsured, vulnerable populations. And that just hasn't happened in those counties that I just named quite yet.
Well, when we had a conversation not too long ago, lining up this program, I'd been contacted by a friend who was telling me that I think in Prince Edward County, a couple of nurses or people were starting an effort, and so it's one that maybe is in the process of bubbling up, that not yet a member, but is there trying to provide some services.
Exactly. I think you're referring to the Heart of Virginia Free
Okay.
Clinic that's located in Farmville, that's started by a small group, a very passionate group of nurses. They happen to be retired, and they do have the support of local businesses, and they're currently operating about 1 day a week. Again, these are volunteers and retired nurses with lives, but they saw a demonstrable need in the community for a service for uninsured people, and they are there to fill that need, at least 1 day as of now.
That's an important point that you're making about the days, because probably the clinics aren't all open 7 days a week, 24/7.
No.
And what it probably really varies, again, maybe depending in part on the volunteers that are there to staff them.
In large part on the volunteers. We were pleased to serve about 75,000 patients last year. Some clinics are open normal business hours, others are open only sometime, and it is very much dependent on the volunteers and their ability to staff the clinic, whether it's for dental or general medical, behavioral health services, pharmacy services. We do cover the full array of services, but again, the availability varies based on the availability of the volunteer.
So some is behavioral health, not just the physical health. Now, is that, again, it's probably, if you look at the map and look at the 60 or so, it's not in every one, I imagine. It's just, again, depending on the providers.
That's true. So other 60-member clinics, 45 of them have some level of behavioral health service.
Oh.
So when I say some level, that means maybe they have an LCSW, a licensed clinical social worker who will come every Wednesday evening, versus there are some clinics who are fortunate enough to have a psychiatrist or a psychiatric nurse practitioner even, which is a rare commodity in the Commonwealth, to have a psych NP. And then maybe they can come 3 or 4 times a week. And then we even have 2 clinics that are fortunate enough to be able to afford to actually have on staff, payroll, a psych nurse practitioner or a psychiatrist.
So you mentioned a couple of the counties in Southside Virginia. Thinking about Southside as a region and then Southwest as a region, what could you tell us about the regions and the availability of services through free or charitable clinics?
So in Southwest Virginia, let's start there. So starting at Roanoke and going west out to Wise and Norton, we have approximately 26 of our members are within that health planning region alone. So that really, I think, demonstrates that the tremendous need that exists in Southwest Virginia, the commitment to the vulnerable populations from citizens in Southwest Virginia, that they're committed to doing something for their fellow constituent and fellow man. A lot of these started as faith-based organizations and have now evolved into something else, still a free or charitable clinic. We have a clinic that concentrates strictly on behavioral health in the Roanoke Valley, and these are patients that don't have anywhere else to go. They can't go to the hospital necessarily. They don't go to a private practitioner because they're uninsured.
You know, you submitted some photos which when I looked at them, I was somewhat surprised. And I think our viewers might be too, because there probably are stereotypes of who goes to a free clinic. And so you have permission from I think 3 or so individuals to have their pictures up, and we'll get those up on the screen. And as viewers are looking at those, tell us a bit more about the population that you do serve.
Sure. It's primarily adult. The majority are women. Most of them are working, sometimes 2 and 3 jobs. So this stereotype of someone who isn't working and contributing to society is generally very false. They are people who care greatly about themselves, about the communities that they are part of. Most of them do. I think it is 85% of the patients do have a chronic condition. So it's not just their general medical conditions that are being treated, but it is a chronic condition. And as Linda mentioned, a significant portion have behavioral health issues, which can exacerbate the problems of chronic conditions. It can exacerbate issues of employment, things of that nature. But by and large, they are female, they are employed, they may be part of families.
Anything that you would add to that? That was a good description.
Yeah, I would add that the 2 to 3 jobs that they have, these are part-time jobs that are not offering any type of health benefits, and so that therefore they need to go to a practice, a clinic that will treat them regardless of their ability to pay and whether or not they have health insurance. These are patients who, as Colin has pointed out, are very sick. They meet the income eligibility of our clinics. Most of our clinics have income eligibilities including 200% or below of the federal poverty level. So these are folks who don't qualify for our current Medicaid program and don't necessarily make enough money to purchase on the private marketplace exchange. These are patients who are working hard. They are contributing to their communities in various ways. These are taxpayers, and they frankly need the clinics.
You know, there's one clinic that's made a great deal of attention out in Southwest Virginia. I think the Health Wagon, as it's called. Some of us have seen it on 60 Minutes, or we've read about articles based on that. Tell something, our viewers, something about the region that clinic serves.
So that clinic serves Appalachia. Appalachia, Virginia. They're serving Wise and Norton and many other communities that are out there up and down the mountains. And these are coal miners, these are working families who do not have other means for their health care other than to go to the St. Mary's Health Wagon that's out there. They have 2 locations. They have one in Wise County, and then another smaller location in St. Paul. They have their Health Wagon, which is a mobile unit, and they serve probably around 3,000 patients a year who are completely uninsured. The patient that you may have seen on 60 Minutes, her name was Glenda. Glenda went to the free clinic, to the Health Wagon free clinic out in Wise. She was already very sick, and through diagnostic treatment and procedures at the Health Wagon, they determined that she had metastatic lung cancer that was spreading to her brain. Unfortunately, there were no providers out in Wise County who would treat an uninsured patient, and during the filming of that 60 Minutes piece that you referred to, Glenda passed away. And this is unfortunately a story that can be repeated by every single one of our members, at least once, if not multiple times, that there are sadly patients who die while they're waiting for treatment, for a specialist or for a healthcare system to treat them, but unfortunately they don't have health insurance. And of course, folks want to be paid, and they deserve to be paid.
So would I be right in thinking that there may be some specialists among the 5,000 who volunteer, but they're probably not volunteering in a facility where they could do the kind of surgery that may need to be called for at times?
That's exactly true. So of the 5,000, there are definitely a large number of specialists, especially here in the Richmond area. We have a clinic that's called Access Now. Access Now provides all specialty care using volunteer specialists, dermatologists, cardiologists, general surgeons, etc. But in Wise County, they don't necessarily have the luxury of having a lot of specialists out there. And same would be true for other communities. While they may have, some clinics may have specialists volunteering in their clinics, they certainly don't have the surgical equipment to perform brain surgery or lung surgery on a patient who has metastatic lung cancer.
And the clinics can serve as a reference point to the hospitals. You're correct. Most of the clinics do not have the capability to perform surgeries, et cetera. But by having specialists who volunteer there, who have a relationship with the hospital, as part of that, they can bring patients to the hospital for surgery. And where the hospital's benefit is that it keeps these patients out of the emergency room when they're being diagnosed, as opposed to showing up there for conditions or treatments that could be rendered in the clinic. So there is a synergy between the volunteers, the hospitals in our community, and the patients that receive the care.
You know, we hear the expression that hospitals don't turn anyone away, they can go to the emergency room, but you're providing a service that keeps thousands of people away from the emergency rooms. And then the hospitals, I guess, would be somewhat obliged, not that they wouldn't do it voluntarily, but to provide the other service. If you were the doctor, the specialist referring, and you were on that part of that hospital and referring someone, you'd hope they would get the kind of treatment that they need.
And many patients do. In 2012 alone, the Virginia hospitals provided $600 million in charity care. Now, all of that wasn't 2 and 4 free clinic patients,
Right.
but a lot of it was. There are, well, many of their hospitals, if not most of the hospitals within the Commonwealth, are incredibly generous to our clinics, but they can't do everything for all 75,000 of our patients. And frankly, David, that's one of the reasons why the association is in favor of filling the coverage gap and expanding Medicaid for patients up to 138% of the federal poverty level, because the hospitals, as you know, are seeing their disproportionate share of payments from CMS, Centers for Medicare and Medicaid, reduced over the next several years, and therefore they're not going to have the ability to continue to provide the level of charity care for our patients that they currently are, which we already have documented that it's not enough. And we're bracing ourselves for even less of that generous charity care from our hospitals and health systems, just out of basic economics and business.
You know, you've answered in part the next question I was going to ask, because I wondered, in this ongoing struggle that's taking place here at the state capitol about, do we expand or do we not expand? Is it in the budget? Is it not in the budget? And as time moves on and not yet resolved, at the time we're having this conversation, at least it's not yet resolved, you've answered it in part that free clinics are not, as an association, are not opposed to this, but you say are supportive.
Sure.
Yeah.
I'll touch on that briefly. If Medicare expansion is implemented, and with fully implemented ACA guidelines, we still anticipate that there are going to be upwards of 300,000 uninsured people in Virginia. And those people will still need access to the free and charitable clinics. Within our clinics, the 60-member clinics, some of those are saying, as I look to this new world of healthcare reform, what role do I play? Maybe they will begin to render care to Medicaid recipients and actually bill payers for Medicaid services. So just as the General Assembly is grappling with what this might look like, our clinics are as well. And that's where Linda and our association can provide guidance and direction in terms of what those opportunities might look like, what it means if now a free and charitable clinic decides that they want to be a Medicaid provider. There are credentialing requirements, standards, contracting, things of that nature that we can provide some assistance with as well.
So you're, one has heard here around the Capitol that at least one of the two chambers is saying, we're putting more money into free clinics. And the implication that I have gotten from that is that will take care of the issue, but you're saying it won't.
So, David, the House of Delegates, I think you're referring to, did put in their budget an additional $1.5 million for the Association of Free Clinics, and we would just in turn distribute those to our members. The $1.5 million, while very, very generous, does not begin to even touch the 400,000 uninsured patients who would be eligible for the Medicaid expansion. For our members, $1.5 million represents 7,500 patients. That's how much it would buy, how many services it would buy for individual patients.
Okay, and I think even we have some graphics that we'll put up on the screen too, thinking about even where the health wagon is, that there's tremendous numbers in Scott County, Lee County, and Wise County that would benefit if there is this expansion.
That's right, significantly. As far southwest Virginia, including from Roanoke all the way to the counties that you named, Scott, Lee, and Wise, have the highest concentration of uninsured patients in the entire Commonwealth. This is not surprising. And some of our other populated areas, the city of Richmond certainly has a high number of potentially eligible for this expanded insurance, whether it's called Medicaid or Marketplace Virginia. We have an opportunity to work with these localities and with our legislators to reduce those numbers greatly.
I think those 3 counties combined with expansion, there's roughly 5,000 individuals that would be eligible for coverage should Medicaid expand, 4,900 or 5,000, somewhere thereabout.
And again, as I looked at the map, it seems like the area of the Commonwealth that has the fewest free or charitable clinics is probably Southside Virginia.
That's true.
And another area with probably a significant number of people needing care who don't have insurance.
Yes, yes. So while there are unfortunately not free or charitable clinics within Lunenburg, Nottoway, Mecklenburg counties currently, we certainly would love to work with their communities to maybe start a free or charitable clinic if that's what is best for that particular community. There are other safety net providers within those localities. For example, the federally qualified health centers do have some sites within those communities, but the federally qualified health centers, or FQHCs, have already said themselves they're maxed out on the number of uninsured patients that they can continue to treat based on their resource availability, just like us. So our hope in working with the FQHCs and other providers and businesses and the chambers of commerce, et cetera, around the Commonwealth is to really look at this expanded coverage for folks living up to 138% of the federal poverty level, so we can provide additional services, or we can provide services, period, to a community that doesn't have any.
So viewers that are thinking there's a need for one of these clinics in their region, if they reached out to the association, you could help provide them with some guidance to how to start one?
Sure, absolutely. We would put them through a litmus test. We would
Yes.
ask them all kinds of questions to see if truly is that what's necessary. Is it in the best interest of their community? Can their community sustain a free and charitable clinic? Because despite the name free and charitable, it's not free to run a business like a healthcare practice. We still have to pay rent, and we still have to buy supplies and medications, et cetera. And for most of our clinics, they have paid staff. So we want to make sure before we would launch a free clinic, whether it's in Lunenburg or Nottoway, even with a demonstrable need, that community, like the community that you mentioned where the Heart of Virginia is located in Farmville, that they're really going to embrace that organization and they're going to sustain it.
So a board member must keep you quite involved. People on the board, are they from healthcare suppliers or healthcare, or are they free clinic people? Or
It's a combination. First and foremost, it's a fantastic board. It's an honor to serve. I'm in my 2nd year as board chair and my 7th year on the board. I'm fortunate enough to be part of Anthem Blue Cross Blue Shield. Our board consists of a combination of executive directors from clinics, and we try to complement services from business professionals in a variety of different areas, suppliers, professional services, you name it. We look for board members who have a heart and a passion for the mission that we have. We look for board members who complement our skill sets. We look for board members who are committed to the mission of the free clinics. It is a labor of love. We're fortunate to have Linda as our CEO. She makes my job easy.
That's good.
And the member clinics, it's so easy to represent them. If you've ever been in a clinic, you'll see this is not substandard care. This is compassionate care. We hear story after story of folks who are no longer eligible to receive care from a free clinic, and they don't want to leave. They want to stay in that clinic. They say, can I continue to get care from you even though I now am fully insured? Those are good stories to have. It's nice that we've developed this patient-centered medical home approach, and I would say that the care that our members receive at a clinic is second to none.
Colin, Linda, thank you both for being on This
Thank
Week
you.
in Richmond,
Thanks,
and I
Ian.
know you've helped our viewers, so thank you both.
Thank you for
Thank
Have
having
you.
you
us.
back again.
Thank you.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.